I'm Dr. Emma Milne. What is telemedical abortion and why is it important? That's what I'm going to be talking about in today's video. So telemedical abortion, it's been talked about on Twitter and it's on social media, and it is hitting a small amount of news outlets at the moment. So I think it's really important that we talk about it and see what is it and what's the big issue. Well, telemedical abortion is the ability to access abortion through a phone or video consultation in your home. So you speak to an abortion provider, they kind of talk you through your health and well-being and the general information that you need to know about accessing a medical abortion. And you don't have to necessarily go into the clinic. Some people do. Some people will go into a clinic partly because they will choose to, or partly because the medical professionals believe it's important that that person is seen in person in a clinic. But for a number of women, telemedical abortion means that essentially the pills get delivered to them at home through the post. So it's legal at the moment in England and Wales and Scotland. It's being it was introduced in 2020 due to the COVID pandemic. Prior to March 2020, all women had to present in a clinic for the first administering of the pill. So as I've already talked about in previous videos, abortion, when it's a medical abortion, is conducted through two pieces of separate medication. Prior to 2020, the first medication had to be taken in the clinic, so there had to be a face-to-face appointment, and then the second medication could be taken at home. Due to the pandemic and concern about women going into clinics at a time when we didn't know or understand a huge amount about COVID and were very worried about the transmission of the virus, the government signed in temporary measures to allow for medical abortions to take place at home, either for a period of 2 years or until the pandemic had finished, whichever of those two occurrences happened first. So the deadline for when telemedical abortion might come to an end is March 2022, 2 years on from the start of the pandemic. So why is this important? You could argue, the pandemic is arguably, it's still a pandemic, who are still very much saying it's a pandemic, but you could say it's winding down. We're possibly getting to a point where we're learning how to live with it. I appreciate that's a contentious issue and some people would disagree, but there are those who would argue. So why do we need to keep telemedical abortion? Well, I would argue that there are a number of key reasons. The first is that it's incredibly safe. So the vast majority of women who access telemedical abortions are in the very early stages of their pregnancy. So it's only legally available to those who are 10 weeks or under 10 weeks within their pregnancy. So we're talking, very early in that pregnancy stage. And what the data shows us from women who have accessed telemedical abortion over the last almost 2 months, so 22 months or so, is that women are incredibly good at working out when they become pregnant and the stage of their pregnancy. They don't need medical professionals to help them do that. They're capable of dating their own pregnancy. It's very safe in that respect then, because it does mean that we are giving the medication to women who are in the correct stage, who are under 10 weeks. Secondly, it's safe because this medication is not medication that needs monitoring by a doctor or a nurse when it's given. The abortion providers do have helplines, so if a woman has a difficulty while she's using the medication, she can ring them and she can get support either over the phone or through face-to-face consultation if that's needed. But in the vast majority of cases, women don't need that sort of support. Medical abortions are incredibly safe. So there isn't safety concerns in respects to telemedical abortion. The other reason why telemedical abortion is really important for women is because it allows women who would potentially find it very difficult to access abortion if they had to go to a clinic to access this medication. So most abortion clinics tend to be in big towns, in cities. They tend to not be in rural areas. Therefore, there's a geographical difficulty for some women in terms of how do they even get to an abortion clinic. There's further difficulties for women who are living in poverty. Potentially they don't have their own car. Potentially they're going to need to use public transport. public transport in lots of rural parts of the country are not very good, so they're potentially going to have to use numerous forms of public transport. They might have to take days off work, so they risk potentially losing pay in order to be able to access an abortion. They potentially have children that they need to look after. What do they do with their children? Do they have to then pay somebody to look after their children while they're accessing an abortion? What about women who are living in abusive relationships? How do they get to the clinic without their abusive partner finding out that that's what they're doing? We know for a fact that preventing women from having abortions is a form of coercive control that men do exert over the women they abuse. What about disabled women? Women who find it incredibly difficult to get into abortion clinics or into town perhaps, not even to the clinic, just physically to get on a bus. What about those women? How do they access abortion clinics? There's a whole host of reasons why women might find it very difficult to physically get to a clinic. Therefore, telemedical abortion has revolutionised abortion services for these groups of women, making it possible for them to be able to receive medication simply through the post after a phone consultation. This is really important. We need to, for equality and diversity reasons and supporting some of the most vulnerable women in our society, we need to continue telemedical abortion. A further point that's been raised by critics of telemedical abortion is that some women are using the services in order to access abortions when they have their pregnancy is far later than 10 weeks. So potentially their pregnancy is 14, 15 weeks. Potentially some women, it's been argued, are accessing telemedical abortion so that they can end a pregnancy that's over 24 weeks. You'll remember from my previous videos that most terminations of pregnancies that occur after 24 weeks will be illegal under the Offences Against the Person Act. Now, the data doesn't support the fact that women are purposely going out attempting to access telemedical abortion so that they can end late-term pregnancies. There's just no data that supports that. There have been a very small number of reported cases, but as my research shows, these women are very likely to be incredibly vulnerable and actually to need our support. So seeing these women as the main problem and seeing them as the reason to end telemedical abortion just simply doesn't add up. The thing I always say is some people will drink and drive. They'll drink alcohol and then they'll get in their car and they will drive. That doesn't mean we should ban all alcohol use. That would be a completely disproportionate response to the fact that some people drink and drive. It's exactly the same for the very small number of women who access telemedical abortion when their pregnancies are beyond 10 weeks. That is not a reason to ban telemedical abortion when the vast majority, and by vast majority I mean 0.04% according to one study. That's the number of women who were over 10 weeks when they tried to access the medication. It's a tiny proportion. Why would we ban telemedical abortion because of those women? It just doesn't make any sense. And the final argument, and I think a really compelling argument as to why telemedical abortion should continue, is because it offers women the privacy, the dignity and respect that they need to control their own body, to be able to take medication that prevents them from having to continue a pregnancy in their own home, in the comfort of not having to go to a clinic. It's not medically necessary. It is purely a burden that is put on women because of outdated legislation from 1861. So, telemedical abortion needs to continue. I would urge you to support the British Pregnancy Advisory Service's campaign to write to your MP and express to your MP why it is so important that telemedical abortion continues. This is a real issue for women today. If we end telemedical abortion, we're going to see a drastic impact on services that are available to women, as well as to our basic reproductive rights. Reproductive rights are human rights. You take this away from us, you are damaging the human rights of 50% of the population. That can't be allowed.